I'm Robert Burakoff from Boston and Brigham and Women's Hospital and chair of the Public Policy and Advocacy Committee, the AGA. We just had a wonderful day on the Hill meeting with Congress people and senators regarding many of the issues concerning the health care reform bill. The major topics that we're representing with the Alliance of Specialty of Medicine, which represents 10 specialties and over 200,000 physicians, was some of the very important issues facing us in day-to-day practice and caring for patients with specialty problems and chronic illnesses. We've addressed the sustainable growth rate, which is not sustainable. We can report that the House bill includes a provision to correct it. We do not know yet about the Senate bill, which has to be reconciled in the Finance Committee. We're very hopeful that we'll address this issue of the sustainable growth rate and come up with another formula that will be beneficial to physicians and particularly specialists. In addition, we discussed health information technology. The Congress is moving along quickly to provide us with software, but we have asked that in the Senate and the Congress that they be aware that for specialists we do not have the proper software programs, and we'll need a longer period of time to institute software for compliance in terms of provisions as specialists in the future. Certainly will take longer than 2011. Additionally, we talked about access to specialists. We are hoping that patients with chronic conditions will be able to choose specialists if they desire to be their primary care physicians, so we're not competing with primary care physicians, and that access to specialists will not end up in a gatekeeper situation. This seemed to be received well in Congress and with the senators that we met with. Finally, the Comparative Effectiveness Program, which institutes guidelines for us to follow in the future, for us to either be penalized or to benefit financially, was discussed regarding the fact that specialists must be at the table to work on evidence-based guidelines to help us in the future as consultants to the guidelines that are chosen by CMS and specialties in the future. Finally, obviously a very major issue is tort reform for all physicians, primary care as well as specialists. We made our appeal concerning the increasing cost of health care as a result of ordering unnecessary tests and practicing defensive medicine in terms of the new health care plan to help drive down the cost of health care by providing us with legislation for tort reform. Stay tuned to eDigest to learn more about public policy initiatives that will be coming out on a very regular basis, as the House has just completed their first bill for health care reform. The Senate is now working on their bill in the Health Committee and the Finance Committee, and it'll be quite interesting to see a reconciliation of these bills over the coming weeks. And if you have comments or suggestions concerning the topics that we discussed as participants in the Alliance of Specialty of Medicine, please email us. It's extremely important that we hear from all members, because as close to 100% participation as possible is key to our success and our ability to represent you in the House and the Senate.